If you're over 50, your doctor might be slowly making you sicker. Not intentionally, but through a system that rewards action over wisdom. I watched this happen to my own mother. She went in for what felt like routine health care. She left with 6 new diagnoses, 4 new medications, and a fear that wouldn't leave her alone. The worst part? She actually got worse. What I'm about to tell you will challenge everything you think about staying healthy after 50. It might even upset some people who profit from your worry, but you need to hear this. Here's what nobody talks about in the health industry. There's a principle called the cascade, and once you understand it, you'll never look at a medical test the same way again. It works like this. A doctor recommends a screening. Maybe you feel perfectly fine, but prevention is good, right? So you say yes. The test finds something, a shadow, a spot, a number that's slightly off. Now here's the trap. That finding has to be investigated. More tests, more specialists, more procedures. Each one carries small risks that add up. And often, research shows most of the time, what they find was never going to hurt you. But now you're labeled as sick. You're on medications, you're anxious, you've lost months of peace. And that's the cascade. It starts with one test you might never have needed. Let me show you what this looks like in real life. You're 67, you feel great, active, no symptoms at all. Someone suggests you get a full body scan. They promise peace of mind, a complete picture of your health. So you do. The radiologist finds a nodule, maybe in your lung, 3 millimeters, smaller than a grain of rice. The report says, recommend follow-up imaging. Now something shifts in your mind. You can't unsee that word, nodule. Suddenly, every time you take a breath, you think about it. 3 months later, another scan. The thing hasn't changed, but the doctor recommends a specialist anyway, to be thorough. The specialist wants a biopsy, a needle into your lung, anesthesia, bleeding risk, infection risk. Here's what the research actually shows. When doctors scan healthy people your age, they find something unusual in 90% of people. 90%. But the vast majority of these findings never cause any problems. They're just being human, being 67. They're like wrinkles on the inside. The heartbreak is this. Studies tracked people who got these peace of mind scans. The scanned group didn't live longer, they didn't avoid disease, but they had significantly higher rates of anxiety, depression, and unnecessary procedures. The scan didn't make them healthier, it made them sicker. Now, I'm not saying ignore your health. That's the opposite of what I'm saying. Here's where it gets interesting. The best health assessment doesn't come from a machine. It comes from your own body telling you the truth every single day. Can you climb stairs without getting winded? That's real health data. Can you get up from a chair without using your hands? Can you walk for 30 minutes without pain? Can you sleep through the night? These aren't poetic, they're biological facts. A doctor who actually knows how to assess health will spend time with you. They'll ask about your medications because I guarantee at least one is doing more harm than good. Your diet, your sleep, your relationships, the boring stuff, the stuff that actually determines whether you age well or not. A scan looks for problems that might not exist. A real assessment optimizes the health you already have. That's the difference between fear-based medicine and function-based medicine. Here's another place where doctors see this constantly. You're 74. You forget the name of an actor. You walk into a room and lose your train of thought. Normal. Happens to everyone. But your kids get worried. They've heard about Alzheimer's. They insist you get a brain MRI. The scan comes back. The report uses words like cerebral atrophy and white matter lesions and small vessel disease. These words sound like your brain is falling apart. But here's the clinical truth. Those findings are completely normal for someone your age. They describe what every 75-year-old brain looks like. It's like scanning your skin and being shocked it has wrinkles. Of course it does. But now you're walking around thinking you have brain damage, thinking Alzheimer's is coming. Meanwhile, research shows that over 90% of healthy people over 75 have abnormal-looking brain findings that mean absolutely nothing. I've seen sharp, brilliant people read books, manage finances, play chess with MRIs that look terrible.
And I've seen people with early memory decline whose MRI looks fine. The picture doesn't match the reality. Here's what actually helps. A 10-minute cognitive test right in the office. Remember 3 words, draw a clock, count backwards from 100 by sevens. These tests actually measure how your brain works, not just how it looks. And if they find a real problem, most causes of memory changes are reversible. A medication, low B12, sleep apnea, depression. We fix the cause, the memory comes back. No MRI, no anxiety. We're treating the person, not the picture. Here's where it gets really important. You're 70, coming in for surgery. The hospital protocol, stress test. Everyone over 70 gets one. But you can walk 2 miles, no chest pain, no shortness of breath. Your daily life is already your stress test. You're passing it every single day. Yet they put you on the treadmill anyway. And here's the problem. Stress tests have a high false positive rate in older adults. The test says something's wrong when nothing is. Could be medication, could be your heart doesn't respond the way it did at 40, could be 100 things. But once that test comes back abnormal, the machine starts. Cardiac catheterization, a tube through an artery to your heart. Invasive, risky. Often they find what you'd expect in a 70-year-old heart. Some plaque, some narrowing, nothing that needs intervention. But now you're a cardiac patient. You're on new medications. And psychologically, maybe you stopped playing tennis, started protecting yourself from exertion. The test that was supposed to protect you stole your confidence. Listen to your body instead. That's the real diagnostic tool. If you can climb stairs, walk at a good pace, do your normal life without chest pain or unusual breathlessness, your heart is telling you it's okay. That's enough. So what I want you to understand is this. Health after 50 isn't about having perfect test results. It's about function. It's about doing the things you want to do. Spending time with grandchildren, taking walks, reading, living without fear. And sometimes, often, the best thing for your health is to say no to something. Not to medicine, but to unnecessary intervention that creates more problems than it solves. When a doctor recommends a test, ask why. Ask what happens if it finds something. Ask if there's an alternative. Then decide based on what matters to you. You're in charge. Not the protocols, not the computer reminders. You. And the more you understand about what you're agreeing to, the better choices you'll make. If this information helped you think differently about your health, share it with someone who needs to hear it. And if you want more honest conversations about aging well, about medicine that actually serves you instead of serving fear, subscribe, because these conversations matter. Your health matters, your independence matters, and you deserve information that respects both. You've already made it this far. That tells me you care about aging on your own terms. That's rare. That's something to be proud of. Take care of yourself. And remember, sometimes the healthiest decision you can make is knowing when to do nothing.